My name Lalan Gupta. My wife name Geetha Gupta. My wife was suffering from regular bleedings even during period or without period since a long time, and we consulted some other doctors in other hospitals. They suggested some treatment which did not work out. So finally I searched about best doctors in our area who deal with gynecological problems, and I found that in Koshys hospital they have good doctors. So when I came to Koshys hospital, I met Dr Sangeetha, who is a specialist here, and she went through all the reports and all the scans, everything, and she told that there is a heavy fibroid problem inside the uterus, and we need to, if we do the surgery, then this problem will be solved. So after her consultation, we got admitted in the Koshys hospital, and they performed the surgery, and during the surgery all this one fibroids were removed. After that it took almost 2 to 3 days of further recovery in the hospital, and after that we got discharged. So this was a very nice experience, and it is very professional approach by Dr Sangeetha as well as the entire system of the Koshys hospital. All the support staff, nurses, and even the administration, there is very good help and support they provided all the time. Thank you very much.
Hi everyone, I'm Dr Sangeetha, and today we're discussing about fibroid uterus and one of the patients who underwent surgery for this condition. So Mrs. X came in about 47 years old, and she had been suffering with heavy menstrual bleeding for about 2 years. And intermittently she was treated with oral medication which failed, and then she was treated with a Mirena device which also failed, and that necessitated the need for a hysterectomy procedure. Fibroid uteruses are usually asymptomatic and occur in about 5 to 20% of population at any given time. There are certain risk factors, for example the amount of hormonal exposure, the number of children one has, whether there's any family history of similar conditions in the family, and any other occupational hazards that may lead to fibroid uterus. So the problem in this particular patient was that she was having such heavy cycles that she constantly ended up being anemic and requiring repeated transfusions. And despite her medical treatment of the condition, it had not worked, and so the only option left was to have a surgery. Post-surgery, her symptoms will obviously stop because once the uterus is removed, there is no area for the bleeding to occur. In this case, we chose a laparoscopic approach for the hysterectomy because it means shorter hospital stay, quicker post-op recovery, and less blood loss and less complications. And after the laparoscopic hysterectomy, now patient will go home and come back after 7 days for the suture removal. And due to the anemia that was incurred because of having the fibroids, she will need oral iron to go home, and she'll also need some proteins and vitamin C to help her healing, as well as a short course of an antibiotic. The symptoms as such of her problem will completely stop. However, because of the operation and because of the ongoing blood loss, she would need about 3 months to feel like herself again. We will call the patient in after 1 week for the removal of the sutures, and the patient would also need to review along with her histopathological report, so we can assess and conclude that the uterus that we had taken out indeed was really a fibroid uterus, and whether or not there are any other conditions that we need to worry about. I'm hoping that she is happy and that her life has improved post-surgery.